welcome. My name is Chris from ChristopherHole.com and welcome to this week's whiteboard presentation where the topic is medial ankle sprain. Now I'm sharing this video for a couple of reasons. Obviously the normal one is to educate and to share information and to upskill the layperson on certain injuries and illnesses and things about health and fitness. Obviously this is about an injury to an ankle, and sort of the second reason is basically off the back of the first reason. Is I had someone come to me with an injured ankle. It had been diagnosed as a lateral ankle sprain, which is the opposing injury to this one, and it turns out after a few weeks of treatments that it was more to do with the tissues on the inside of the ankle than on the outside of the ankle. Now that's not to put down the professional that she was working with previously, because she only had a few sessions with them, and she was seeing me for a lot longer, which gave me the opportunity to explore a little bit more. And I'll explain a little bit more why the diagnosis may have been put down as a lateral ankle sprain and rather than a medial ankle sprain as we get into the video. So that, I guess, is a quick intro, but just as a quick one before we get into the information and the bulk of the information that we're going to be talking about, just quickly mention my social media channels. So you've got Twitter at Christopher Hole, you've got Facebook, which is Christopher Hole Training, and you've got Instagram, which is Christopher Hole. So please do come along there, like and follow. It'd be great to have you there, answer any questions that you may have, and share any information that you may want with you. Alternatively, come to the website, which is christopherhole.com/workshops. Click on the workshop Pain to Performance, and that workshop is all about injuries, fitness, exercise, training, and sort of the journey from the injury through rehabilitation and back into fitness. And the outcome is to help you understand how you can maximize your fitness and minimize your risk of injury in the future. So that's kind of the aim of that workshop. So if you enjoy what you hear here, then obviously come along to that. It'd be great to have you there as well, meet you in person. So that is the introduction. So back to the main bulk of this topic, medial ankle sprain. And what are we talking about here? Well, the medial ankle sprain is the less common ankle sprain. Now, the lateral ankle sprain that I mentioned before is this one. So this is the normal one where you turn your ankle. You go onto the outside of your foot, and all the ligaments on the outside of the ankle either stretch or they tear. Now, depending on the tear will depend on the severity of it. So that's your lateral ankle sprain. That's more common. This is now your medial ankle sprain, and it's where the foot turns inward and the ligaments and the tissues on the inside of the ankle, on the inside of the foot, become stretched or torn. Now, that's a part of the reason why it can get missed and misdiagnosed, is because it's just not that common. This is a lot more common. So if people come in with a swollen ankle, you can't really see where the damage is specifically, but you will make a sort of a judgment, and normally a well-informed judgment, that it's a lateral ankle sprain, just because the percentages of that are so high. Now, that's not to mean to say as the swelling goes down you can change that diagnosis, because you'll start to see the client will start to feel different things than they should be experiencing with a lateral ankle sprain. So that can be a part of the reason for a misdiagnosis, as me and my client experienced. So again, it's not to say that they did anything wrong. I don't know what they did. I don't know who they are. I don't know who they were. So it could have just been an honest, judgment on that. It usually is an lateral ankle sprain, which may well have been where I started. As the swelling comes down, as the patient can experience more around the ankle, then you can start to figure out a little bit more specifically what it was. But to some degree, the initial treatment wouldn't change, but then as you move on, the treatment would then change. So that, I guess, is sort of the first difference between the medial and the lateral ankle sprain. What we then come on to is the basic anatomy of what we're working with when it comes to treating a lateral ankle sprain, and it's looking at the deltoid ligament of the ankle. Now, here you can see this is a picture of the inside of a foot. Obviously, there's the big toe, you've got the bones of the foot, you've got the heel bone, so on and so forth. Now, what we're focusing on here are these four ligaments here. And what started to happen as I started to treat, now a lot of the inflammation had gone. So I got into her quite a later stage, if you will. She came to me for personal training. She obviously mentioned that she'd had a problem with her ankle. There wasn't very much mobilization in it, so I took it on myself to work on some therapy with her to get her ankle moving, so we could get more out of the exercise. So what started happening is I focused on the lateral ankle sprain that she came to me with, or said that she had. So I worked on that, and then after a few treatments, it became apparent that it wasn't happening. Now, I just put that down to the ankle being a very stiff joint anyway in most people, and it just needed a little bit more work. So I kept working, a little bit deeper, a little bit harder, so on and so forth. Again, we got some improved movement, but not a great deal. So what I then started doing is I started exploring a little bit further, and what I found was these ligaments here were very, very tender, to the point of it was very much just brushing my thumb over it. So when it comes to that, and then what we then had off the back of that was an accelerated rehabilitation. She was starting to experience a lot more stable ankle. The stretching that we were doing alongside that and the mobilization we were doing alongside that then became a lot more effective. So when it comes to treating that, it's very simple. All I would get her to do is, we were in the gym, I would just get her to sit on the floor. She would put her sort of leg bent on the floor with the inside of her foot facing upward, and for 10 to 15 minutes I was just working on these 4 ligaments. So I'd work all the way from insertion to origin, from the front of the foot all the way around to the back of the foot, or around the back of the ankle, just slowly just working on little circular movements all the way across. Then I'd work a little bit lower, so on and so forth. So that was essentially my process, and then that obviously then accelerated as we were then to mobilize it a little bit more. Then it became a little bit more effective. But with regards to the process from, I guess, start to finish, so once the injury happens, first of all you want to RICE police. Now RICE is obviously rest elevation, rest ice compression elevation. Then with regards to police, which is a slightly different protocol, if you will, you've got protection, which is initial protection, which might be strapping, which might be, obviously the body will do that to a degree and create a limp for you. So you've got protection, but what you've then got is optimal loading, ice compression, elevation. So you do still want to be loading the ankle and still maintaining a degree of movement within the ankle, because that will aid the healing process as well. Because your body, as long as it's minimal amounts of stress, or I should say the right amount of stress, that will initiate the healing process and to some degree speed it up, more so than if you just lay in bed and don't move it. So it does need that mechanical loading to aid the healing process. And then a part of that is your early onset mobilization. So you want to keep the ankle moving. You want to be able to move it outward, inward, flex and extend. So, pulling your toes to the shin and pointing them towards the floor. You want to try and maintain a degree of that. As the injury settles, it will become a little bit easier and you can be a little bit more persuasive of the ankle. But initially, you just want to be able to keep it moving so it doesn't just completely freeze up and become completely stiff. Along with that, you want some light passive stretching. So again, as the swelling goes down and the healing develops, you want to be able to develop your stretching and become a little bit more in the way of deeper stretching. The next one is proprioception. So again, get your foot on the floor, possibly get your other foot off the floor, or certainly just up onto the toes, and get that ankle and that foot working as it wants to work, which is to stabilize the shin and the knee and the hip above it. When it comes to strengthening exercises, you want to strengthen the surrounding tissues. Now, the balance training, being on one foot, will do a degree of that, but also you can get yourself up on your toes to more effectively work the gastrocnemius and the soleus around it. But essentially, you can try loaded walking, so walking with weights as you become more adept at being back on that foot. And when it comes to massage, you want to be not necessarily straight away with the deep frictions, but essentially you want to be warming the area, and then you just want to be working on it lightly with your thumb. Obviously your pain tolerance will dictate what you can manage, so you work on it. It's just very light little circles all the way across these 4 ligaments from origin to insertion, or from start to beginning, if you will, whatever you want to call it. And then as the pain tolerance comes, as the healing process develops, it's you can then start to go a little bit deeper. So with regards to sort of like a linear flow to that, obviously the first part, the rice and police, is the early phase. What you would then start doing is you would keep it moving. Again, that would be early phase, because at this point you might not be able to stretch it a great deal, you might not be able to touch it a great deal. But with regards to moving it, you may be able to keep it moving to a degree. Then what we start moving into is these last 4. We start moving into more passive stretching, balance training, strengthening exercises, and then moving into massage as well. So these 4 here aren't really that linear. You want to get the massage in as early as possible. You want to get the passive stretching in as early as possible, and also the proprioception and the strengthening as early as possible as well. And your experience will, not necessarily past experience, but your experience of being in the moment with your injury will help you understand what you need to do and when. So alternatively, go and see a professional. Go and say to them you think you've got a medial ankle sprain. They might then tell you different. That's fine. Let them do their due diligence. Let them do their work. But have in your mind, that's where it could be. If it's not getting any better and they fail to explore around the ankle, then you may want to either question them on that or go and see someone else, depending on the rapport that you have with that person. But yes, make sure you're sort of tracking your progress and making sure the ankle is recovering. It is a very stiff ankle. It is a very stiff joint, the ankle, so it can take a lot longer than, say, a knee or a hip with regards to the restoration of your range of movement, if you will. So that brings me to the end of the medial ankle sprain. Hopefully you found it useful. Hopefully you found, I guess, a few little insights that you'll be able to take forward with regards to rehabilitation of if you've got it now or if you want to manage it in the future. Again, they aren't avoidable. It's not 100% preventable injuries. You know, an injury like a medial ankle sprain and a lateral ankle sprain, they're traumatic injuries. They happen in a moment of jumping out the way of something, jumping off a wall, whatever it may be. But we can prepare as best we can. So many thanks for watching. My name is Chris from ChristopherHole.com. I'll speak to you in a future video.